It feels rushed, to be totally honest. We're only just starting to get our hospital numbers and our case numbers under control.
Alberta will soon be easing restrictions dependent on how many people are in hospital with COVID-19. But doctors are raising concern about this approach. Dr. Shazma Mathani is an emergency room physician in Edmonton. She says it's too soon.
We still have over 500 people in hospital. We still have over 100 people in ICUs. And we have to remember that those were the same numbers that we had when we were starting to think about shutting down, when there were healthcare workers across the province calling for stronger restriction measures.
On Friday, the government announced the first phase of easing restrictions, reopening restaurants and gyms with stringent protocols on February 8th, but only if there are less than 600 people in hospital with COVID-19.
As soon as you start opening things up, we know that transmission is going to increase and our case numbers will go up. If we do this at a time where our healthcare system is much more stable, where the hospital numbers are much lower, where our case numbers are much lower, and we have more information about what's happening with this variant and the other variants that are showing up around the world, it's going to be able to be a much more controlled reopening.
That's why she says a few more weeks of the current restrictions could lower our case numbers to a place where we do have that control. Dr. Joe Vipond agrees and says this approach doesn't include those with short-term illness or those suffering from the virus who aren't admitted to hospital.
I've seen lots of people who've just gotten sick from COVID, not sick enough to come into the hospital, but sick enough to be at home and suffer. And there's value in trying to minimize that as well. A large number of the deaths that occur from COVID aren't necessarily occurring in the hospital. These are people in long-term care facilities or living at home who die at home.
Premier Kenney said hospital numbers also have to be decreasing in order to continue the easing of restrictions. But Dr. Mathani says the focus of the government should be solely on eradicating the virus.
We're so close to COVID zero that should be our goal now.
In Calgary, Taylor Brott, City News.